Hi, I'm James, a knee, foot and ankle specialist, and today we're going to talk you through the key differences between a stress fracture and shin splints. So, first of all, when we talk about the anatomy of the conditions, both of them affect the tibia, and they typically affect either the front of the tibia or towards the inside of the tibia. Identifying the differences between them is really important. A tibial stress fracture is recognized as a high-risk stress fracture, so that means that it needs to be typically managed with non-weight bearing initially, then partial weight bearing before beginning a rehabilitation process. If we don't get the diagnosis correct quickly, then it can lead to non-union, difficulties with management, and a slow healing time. So what are the key symptoms of both of these conditions? Well, for medial tibial stress syndrome, it's quite common to get pain along the border of the tibia. It can progressively get worse as you exercise, normally improves at rest. It might be a little bit more sensitive the next day. While a stress fracture follows a similar pattern, the pain is typically more acute, a little bit more localized on the tibia, and it's often painful with all weight-bearing activities, so it's standing as well. Shin splints is typically caused by an overload, while a stress fracture is caused by an overload and the amount of force that's applied from the plantar flexor muscles, so typically your soleus muscle and your posterior tibial tendon. So how that works is when you run or when you try and push off from the ground, the plantar flexors pull on the bone where they attach, causing rotation and bend of the bone. That places stress on the bone and that can lead to fracture over time. We know that if you have conditions such as osteopenia, osteoporosis, or relative energy deficiency in sport, you've got a higher likelihood of developing a stress fracture, and you've also got a 600% increase in likelihood in getting a stress fracture if you've had one before. In terms of shin splints, it's often a quite gradual onset of pain. As we said before, it's quite diffuse over the line of the tibia, and it's normally caused by a sudden increase in volume or activity levels. So that can be the amount of running or walking that you're doing on a day-to-day basis, or it can be an increase in the pace or the type of running that you're doing. So this might be an introduction of hills or hill repeats. So clinically, how can we diagnose this? One of the key differentials that we can have between the two conditions is that for a tibial stress fracture, the pain is usually 10 centimeters or less, so that's the width of 4 fingers usually or less. If it's greater than this, we can have pretty high levels of confidence that it's more likely to be a medial tibial stress syndrome rather than a stress fracture. There's a great Iranian study on this that gives nearly 100% certainty on differentiating between the two conditions based on this 10 centimeter rule alone. So the other thing that can come into the equation is a single leg hop. Both of them can have pain, but typically with a stress fracture you get exquisite pain on hopping, or you can get more diffuse symptoms with shin splints. In terms of imaging, our gold standard would be an MRI. An X-ray can pick up a hairline stress fracture, but the sensitivity is quite low, and our gold standard is an MRI which can pick up a bony stress injury or a bony fracture. The management of both of these conditions are drastically different. So for a tibial stress fracture, often they go into a cam walker boot. They're non-weight bearing for 1 to 3 weeks before progressing into partial weight bearing for 6 to 8 weeks, and then they start to wean out of the boot, walking in trainers at home, then progressing into walking outdoors. Mostly for shin splints, if they're a mild case, you're able to continue running. We might alter the shoes, your cadence, or different parts of your gait, increase your plantar flexor strength so that has greater capacity. In severe symptoms, you might take a period of rest so that your irritability is lower, and there are normally cases where they have pain immediately when walking. So we would wean that off until they're pain-free walking and then usually build them back into running. But this is over a much shorter period of time. Normally we can manage shin splints on a period of 4 to 12 weeks. While a tibial stress fracture, you're looking at a period of 12 to 18 weeks to try and manage this correctly, and that can stretch up to a 6-month period depending on the athlete and any pre-existing conditions or history of fractures before this. So hopefully that's helped you clear up the differences between these two conditions. Both of them are tricky to manage and really important to diagnose accurately and promptly. If you've got any questions, please leave them in the comment section below and I'll try and get back to you. And if you found the video helpful, please like and subscribe to the channel.